FDA approves ORBERA intragastric balloon system for weight loss. The Center for Devices and Radiological Health of the Food and Drug Administration has approved the ORBERA intragastric balloon on August 5, 2015. What is it? The ORBERA intragastric balloon system is a weight loss system that uses a gastric balloon that occupies space in the stomach. The system deposits a balloon in the stomach, through the mouth, via a minimally invasive endoscopic procedure with the patient under mild sedation. A process that takes around 30 minutes according to the manufacturer, Apollo Endosurgery. How does it work? Once in place, the silicone balloon is filled with up to 500 cc of saline, so that it expands and induces a feeling of satiety. The maximum placement period is 6 months, after which it is deflated and removed. When is it used? The system is indicated as an adjunct to weight reduction for obese adults with body mass index of 30 to 40 kg per square meter, who have been unable to lose weight through diet and exercise. It is to be used in conjunction with a long-term supervised diet and behavior modification program, which are to be continued after device removal. Clinical study. Data on the use of the system in 125 individuals with BMI 30 to 40 kg per square meter were presented at Digestive Disease Week 2015. The participants lost an average of 10% of their body weight after the balloon had been in place for 6 months, and maintained that weight loss 3 months after it was removed. When should it not be used? Nausea, vomiting, and abdominal pain were occasionally reported but were manageable. No deaths occurred. Early removal was requested by 22% of the patients. The device should not be used in patients who already have an intragastric balloon, patients who have had prior gastrointestinal or bariatric surgery, patients who have any inflammatory disease of the gastrointestinal tract, patients who have potential upper gastrointestinal bleeding conditions, patients who have a large hiatal hernia, patients who have a structural abnormality in the esophagus or pharynx, patients who have serious esophageal motility disorders, patients who have a gastric mass, patients who have a severe clotting or bleeding disorder, patients who have liver failure or cirrhosis, patients who are known to have an allergic reaction to materials contained in the ORBERA system, patients who have any other medical condition, which would not permit elective endoscopy, patients who have a serious prior or present psychiatric illness, patients who have alcoholism or drug addiction, patients who are unable or unwilling to take prescribed proton pump inhibitor medication for the duration of the device implant, patients who are unable or unwilling to participate in a medically supervised diet and behavior modification program with routine medical follow-up, patients who are receiving aspirin, anti-inflammatory agents, anticoagulants or other gastric irritants, patients who are pregnant or breastfeeding,